Okay. रिकॉर्डिंग पार्ट आप देख लेंगे ना, तो मैं रिकॉर्ड नहीं करूंगा फिर. ठीक है. Okay. Namaskar. I'm Dr. Chhajlani from Indore. I'm a plastic surgeon and I've been in practice since 1986. I did my schooling from Sindhya School, Gwalior. I did my MBBS and MS in general surgery from Indore MGM Medical College, and then I did my MCH from Mumbai from Sion Hospital. I have been a fellow in Miami with Dr. Millard, and in Detroit with Dr. Jackson, and in Frankfurt with Professor Lemperle. I have about 8 international publications, and I have chapters in 2 books. We've been doing a lot of camps and we've done it in 3 continents. And these are free camps done for cleft lip and palate patients and for patients with burn deformities. We run an organization called Cleft Lip and Palate Foundation and the School of Plastic Surgery, and we have conducted about 14 workshops in Indore. And we have 3 free camps every year. And we've done more than about 3,000 free cleft lip surgeries. My interest, other than plastic surgery, is in gardening. I've been doing bonsais for the last 44 years. And I teach bonsais. I do regular gardening. We grow fruits and vegetables on our terrace. And I do advanced gardening, like growing orchids and things. I have, my wife is a pediatrician. My elder son is a maxillofacial surgeon, and my younger son is a dermatologist in Muscat. With these words, let me pay my gratitude to Librate and to Mr. Rohit, who is conducting it right now, and to this august audience for giving me this opportunity to speak to you on management of scars. Rohit, it's fine so far?
Yes, sir.
Okay. So we are going to talk about scars. As dermatologists, you and as general practitioners and as surgeons, we all come across scars, and every scar has a story. And we all know that scars cannot be deleted. There's nothing which can delete a scar. We all know that they mature over time and that they can be modified by surgical or non-surgical means. And that's what we are here to discuss about. So we're going to talk about management of scars, about acne scars, and about hypertrophic scars and keloids. As you know, I'm based in Indore, and I'm in private practice, and I also teach in medical college. Now, as physicians, we all realize that everything is not a cakewalk. ये जो आपके सामने जो ये दिख रहा है, ये करीब 2500 साल पहले लिखा गया था. This shlok in Sanskrit is about 2,500 or 2,500 years old. And it says, I bow to you, O physician. You are the brother of Yamraj. Not only a brother, you're the elder brother. Why? Because Yamraj only takes life. You're elder brother because you take life and money also. So it's a very interesting statement, and it holds very true when we come to scar management. All patients come to us with great hopes when they come for management of scars. And we all know that there's no delete button in a scar. We can take care of scars, but we cannot delete a scar. Therefore, I'll just run through a few slides which says how scars behave over time. So scars are basically caused by a blemish or it causes a blemish because of trauma, cuts or burns. And it leaves a scar which is permanent. And the patient's attention is drawn because people ask uninvited questions or give a slanting gaze, and it brings back the memories of what caused the scar. So we have to know how scars behave over time, and we all know that scars mature in a time frame, and this is a process, and it may take 1 year or more for a scar to mature. That's why when we operate a patient or when we treat a patient, we tell them that the best results would come after 1 year, as it happens in a teaching session. We join in medical college 1 year, and then we get in say May, June, and we get the results in next May, June. So we realize that most of the scars would improve over time, and what looks bad may become acceptable. But this is not the rule. Some of the scars may not behave as we or the patients expect it to behave. Nature is the wonder wound healer. We only put stitches and come out of the operating theater, hoping that the scar would heal. When we take out the stitches, if the scar is not healed, it's going to gape again. So finally, we all pray that the nature should do its job, or the God should do his job. So we know that most of the wounds would heal over a period of time, and even if it is not operated, it'll still heal. That is the beauty of wound healing. Uh, and we operate and bring the skin edges together, which are held by stitches. But when we remove them, if the nature has not done its work, then the wound would not heal. Now, this is how scars behave, and scar management is about understanding the scars. Scars are unpredictable at best, and different people in different areas of the same body would behave differently. Fortunately or unfortunately, scar revision or redo surgery is not always the best answer. Why it's not the best answer? Because scar revision or lasers will not always take care of the scars. And then whenever we do something, people are always very, very hopeful that the scars would go away. That's why again and again we have to strike a balance with the patient and reiterate the fact that scars are always going to be there. We are only taking care of the scar to an extent, but it's not going to disappear. And keloids, widened scars, and stria management are even more difficult problems to treat. To my august audience, if you have any questions, you are free to interrupt me in between. I can always answer your queries in between, or you can send me a written question, or you can do it at the end, as Mr. Rohit has suggested. So, continuing with what we were doing, medicine we should know is, and we all know, is a philosophy. And wound healing and scar formation are one of the wonders of nature, which we have already discussed, helping us live a better and longer life. But scar management is like a game of snakes and ladders, or like walking on a tightrope. And this is what I always show my patients, that everything is with our fingers crossed. And in snakes and ladders, we never know when we'll come back to the beginning. So same is true for scar management. That's why we have to do a lot of hand holding with our patients. When we see a patient, we have to understand a patient and the scar problem. So most important is to observe the patient and the patient's behavior and the scar behavior, to listen to them very carefully, and to be a good observer and listener, and to take a detailed history of what happened and when it happened and how it happened. So this is just a gist of how scars behave. Children and adults behave differently. Grazing wound and petroleum wounds invariably hypertrophy. Widening of scars is very common, and hypertrophy is seen in the first 6 to 8 months in about 2% of plastic surgery patients, but in about 20% of cardiac surgery patients. And fortunately for us, keloids is seen in less than 2 to 3% of the population. Same scars can behave differently in its length. Two adjacent scars may not behave similarly. Two areas of the body, no area of the body is immune to bad scar formation, and genetics also have a role. In the same individual, the scar formation would be different at different ages. And hypertrophy is seen more commonly below 12 years of age and is rare after 60 years age. And there's no way to predict how a scar would behave. And as I said again, and I'm repeating, that scar revision is not always the best answer. These are some things we see on the packaging and on the pamphlets of what our medical representatives give us. And I wish that all these statements were true. Scar never vanished, scar game is never over, and we can never ever say that there was once upon a time a scar. So whatever is given to us as medicine, or what we give to our patients, should be taken with a pinch of salt. When we get a patient with scar, on your left you'll see the scars how they came, and on your right you will see after they've been revised. Now I can tell you with emphasis that all these patients, though they've been operated, the scar is still there. It has not disappeared. We have made the scar qualitatively better. We had this patient who had a chemical burn scar. It had been revised once, and we were the second operating surgeon. If you see carefully, she came with a mole, and this is the scar. All these patients still have scars. Only thing is, we have made them qualitatively better. It's like if we didn't go to school, we would be zero. If we go to school, very few of us would get 100%. But even if we get 60, 70, 80%, we are better than what we were. And this is what happens with every scar. We can by and large make it qualitatively better. Now, this is what most of the patients come to us, and you have to understand they are aged patients also want to look as young as they could be. So patients, we have to make our patients, and we have to, and they need to understand that scar formation is a body process, and we do not have any say in it. The results are not in the surgeons or physicians' hands, and the outcomes are always variable. These are operated patients who had hypertrophic scar or had a widened scar. And when we examine these patients, you have to go into the genetics, you have to go into the family history, and you also have to see that if they have hyperelastosis, if they can bend their fingers backwards by 90 degrees, the possibility of a scar spreading is always high. This is how patients came to us. They had a trauma, and this is the kind of scar they have come to us after it had been repaired. And these are the types of scars we see in everyday practice, and they all come in all shapes, sizes, and formats. I just want to emphasize one fact that a lot of patients have a tendency to, when they have an injury or a burn, they would put either paste, toothpaste, or they would apply Sevlon or Dettol and concentrated, and sometimes mixed with hydrogen peroxide. This is the story of a young girl whose foot came in and the spokes of a motorcycle, and this wound did not heal for 6 months. That's why she came to me. What was she doing? So the history is important. What was the history? She was using concentrated Sevlon or concentrated Dettol mixed with hydrogen peroxide every day, and this is the scar after 6 months. Nothing had happened. It was same as before. What did we do? We stopped all medicines. We asked her to have a shower every day. पेशेंट को बोला नहा लेना, धूप में बैठ जाना, उसको सुखा लेना और सिर्फ पेट्रोलियम जेली लगाना और मोजे पहन लेना. So what was she doing? All medicines were stopped. What you can see, all this pigmentation is gone because betadine was stopped. And everything was stopped. So as the wound heals, the pigmentation goes away. This wound had healed in 1 month. By doing what? By doing nothing. We only allowed the nature to do its work and help the nature heal the scar. So all these things have to be used with a lot of caution and in high dilution. And we have to be aware that a lot of patients, even educated patients, don't read the instructions and use them in concentrated form, hoping that the scars or the wound would heal in a better way. The best time to prevent a scar is especially when you have a patient with a burn or an injury. And very simple instrument like a toothbrush. This was a motorcycle accident. And we just use a toothbrush to clean away all the grit and sand, wash it copiously with saline and water, and then stitched 1 or 2 areas which needed suturing. And this is how the wound healed. It was a primary healing in 1 month. She was not given any antibiotics. So only 3 days analgesics and local cream for 5 days. After that, she was put on petroleum jelly. So by and large, I do not use any anti-scar gels or creams because what works best is the ointment of time, and which is most expensive. Now coming to management of acne scars, so कील मुहां से हटाने के क्या उपाय हैं और उनको कैसे treat करना, and a lot of these you can see on our YouTube channel, and I'll give you the QR code for that later. So when you have minimalistic scar, when they have open pores, doing a derma pen or even doing derma rollers would help when there are minimal scars and open pores only. When you have deeper scars and pigmented scars and white scars, dermabrasion and not superficial, deep dermabrasion, which we do with a diamond fraser, is the best option. And this is how patients are. So this was a patient, we did a deep dermabrasion, and you treat more area than what needs to be treated because you have to shampoo your scar. And this is about 3 months after doing a deep dermabrasion. This was a patient who had acne scars, and then she applied something and she had deep scars. And this is after one sitting of deep dermabrasion. And this would not improve with lasers because white scars do not shrink to that extent. This would not improve with the derma pen or with derma roller. So deep dermabrasion is probably the best option. This is again a deep acne scar, and this is with one sitting. So the pigmentation is gone, and this is after 1 month, over 6 months or a year, which you would see in other patients. Another patient with patchy pigmentation because of acne and a lot of pits, but superficial. We did a full face deep dermabrasion, and you can see here after 3 months, you can see the quantum change in her improvement. This patient had severe acne pits and nodules, and we told her that even after 100 sittings, these scars will not go away. This is, I'm just showing you on your right, that these are with single sitting of deep dermabrasion, and she was happy. She did not even go for a second sitting. Now, when you have deep acne pits, subcision would help, but just subcision would not help because the scar will adhere again. So subcision with fat grafting under the attachments, and then doing a dermabrasion. So this is with one sitting of subcision and fat grafting, and the patient was happy. And then to lighten the scars, we did a deep dermabrasion on him. Now, fat harvesting can be done very easily under local anesthesia, and then this harvested fat can be used for injecting under the acne pits or even under subcisions. This patient had open pores, so we did fat grafting for her under the acne pits, under the malar area and under the lower lid, and this is after a full face dermabrasion. Now, stria is a very difficult problem to treat, and this lady had already had about 24 sittings of chemical peels and lasers, and we now realized that the scars were getting hypopigmented. Now, short of surgery, the scar would not go, but even surgery will not eliminate the scar. We can only remove some amount of scar by doing a tummy tuck or by doing serial excision on her thighs, but scars, stria are very difficult problems to treat. So even if you do lasers or chemical peels, I think you should tell your patients that we're only improving the quality. We may not be able to get them deleted. Now, as I had said, petroleum burns like kerosene or diesel burns and even electric burns invariably lead to deep burns, and they cause tremendous amount of scarring and keloids, and they're difficult problems to treat. Therefore, all these need multimodality treatment. Now, these are operated patients. I had done breast augmentation on her, and then she had scars like this, which took a long time to heal. So for 6 to 8 months, some of these patients may have a tendency to hypertrophic scar formation. They need to be treated conservatively, sometimes pressure garments and sometimes triamcinolone injections will help. This patient had already had a scar, so we had forewarned her that she has a tendency because she had undergone abdominal surgery. So we knew that she may hypertrophy. That's why a detailed examination is important to know that where we are going into. This patient had severe hypertrophic post-traumatic scars, and compression dressings definitely help in reducing the hypertrophy, and then we operated her, and then we did a flap for this scar. Now unoperated scars would invariably lead to widened scars and hyperpigmented scars and deep scars. And scar revisions and dermabrasions and lasers may help to some extent make them better. So these are patients who came to us with scars of these kind, and they were treated with multiple modalities. So what I want to reiterate is the fact that all hypertrophic scars and keloids would not, so single setting would not help. So they all need multimodality treatment. This lady came to us with a trauma like this. There was loss of skin. We did not want to replace it with a skin graft. There was also loss of eyebrow. She's a doctor. And this is after one sitting after 6 months. And we had told her that her eyebrow would be at a raised level. But she was not happy, obviously, and we were not happy because the eyebrow was up and she did not like the scar. What have we done here? We've done multiple Z plasties. How is it? Has it helped? It has brought down the level of her eyebrow. We have not done any skin grafting on her, because on face skin grafts don't look good. So this is without, though there was loss of skin, this is without putting any skin grafts, and by doing a initial repair, primary healing, and then Z plasty, that the scar has improved. Sometimes a tissue expander may help, like this patient had a large hemangioma and we did a tissue expansion, so we didn't have to put any skin on her, and she has a very nice scar, and no skin has been replaced with skin. So this is only with the tissue expansion, and we can extrapolate the tissue expander. This lady had a chota sa til tha. Her nani put nirma powder and chuna, तो उसको चूना लग गया. She had such a big scar, तो तिल का ताड़ हो गया. छोटा सा scar इतना बड़ा हो गया. So what did we do? We put a tissue expander, we expanded her skin, and then we did scar revision with a Z plastic, and this you can see the result. This girl was hit by a truck when she was 2.5 years old. We put a skin graft on her. Around she's a pathologist now. When she was to get married, she came back to us. So we revised this skin graft, and we gave her a S-shaped scar on the medial side of her knee joint. And we removed the skin graft, and now she has a scar, which is a little hypertrophic, but she's much better. This is important, that when there's a roadside trauma, there's a lot of sand and grit. And if it is not removed on day one, they would land up with this, and this will not go with anything else other than surgery. Therefore, the first day one is the best time to remove these to avoid traumatic tattoos. As I said, that these are the, and keloids is the most difficult problem to manage, and it needs a multimodality treatment. And these are the common sites where keloids are present, and we all know it. This patient came with a very small scar and with a very small keloid on the ear. And I said that when we operate on keloids, we do not remove them fully. We remove the frame and remove the we keep the frame and remove the picture. He said, no, I'm paying and I want everything removed. So we said that you have to change your surgeon. He got operated 3 times, and it was like FD, that in every 5 years or 8 years, it multiplied. So every time he got operated, he had twice the scar. So this is after 3 surgeries, because every time he got a full excision, because he wanted a full excision of the keloid. This lady had an intra-lesional excision of keloid, and then we gave her a special earrings. And this is after 5 years that she has minimal scar. So keloids never do a full excision, always do a multimodality treatment, always do an intralesional excision and keep the frame and remove the keloid. Sometimes this patient use a doop batti or agarbatti to write his girlfriend's name, and then the girlfriend changed, and then he wanted the scar to be removed. Now, short of excision and primary closure, nothing else can remove scars like this. And at best, these are difficult areas to treat. This is a tattoo, post-tattoo, and you can see the hypertrophy. This is a fire burn. This is written with acids, and a lot of people inflict self-inflicted scars or write their girlfriend's name, and their girlfriend changes, and then they want the name to be changed. And these are wide or hypertrophic scars, and these are all difficult problems at best to treat. So this is the most, time is the most important factor in wound healing and scar improvement. Bad scars will not become good, but good scars will become better scars over time. And multimodality treatment is needed, as I said. So pressure is the most important thing. Transdermal injection is the next important thing. And multimodality treatments should be used, whether it's lasers or cryo or time or pressure. But this is what would cause. And multiple surgeries will lead to multiple problems in by and large. And we know that what happened to Michael Jackson. So most of the scars do not need treatment. Hypertrophic scars need treatment, and keloids are treated very selectively. These scars will remain forever and may cause heartburns. So in summary, take a detailed history about the injury, treatment, receipt, and the family scar behavior and genetics. Race scars use early use of silicone gel and pressure garment and multimodality treatment with frequent follow-ups, and we should be prepared for all possibilities. And injections and pressure garment, as I said, is most important. So every scar has a story. So, and we all want a happy ending. Now, we all wonder why these patients do not have much scars, because they were plants. This patient had a tummy tuck, and the scar is here. So plant surgeries would have better scars. She wanted a dimple on her cheek, and all the surgery was done from inside. She had a breast augmentation, and you can see she has a minimalistic scar. But these are all plant surgery. This is a gynecomastia. and they have a periareolar scar, and this is a rhinoplasty with a scar all inside her nares. So these are plant surgeries with minimal scars because they were plants. This is what I've said is also available on YouTube channel. You can write Dr. Chhajlani on YouTube channel, or you can take a screenshot of this and you can go onto our channel, which has about 55 films. And you're most welcome to send me queries. And this is my email ID, and this is the phone number where you can give me a phone call. I thank Library for giving me this opportunity to speak to you, and I thank this august audience for being with me. Thank you so much. Namaskar. आपके सवालों अगर रोहित परमिट करेंगे तो मैं आपके सवालों का जवाब दे दूंगा. If there are any queries, I'm ready to answer them.